Joining us now live from Capitol Hill, Tennessee Representative Jim Cooper and Representative Peter Welch of Vermont. And he's been a member of the House Energy and Commerce Committee. Thank you to both of us. Thank you, I should say, to both of you. Representative Welch, may I start with you? Because certainly Vermont and Massachusetts have been held up as sort of maybe prototypes for what universal health care could look like. But boy, over the last week have come under a lot of fire as not being able to sustain the economic burden. You have been a proponent of a public option in whatever health care reform looks like. Are you getting pushback?
Well, not on the public option. The cost is a legitimate concern, and frankly, the CBO report is something that we have to take seriously. In Vermont, when we were pushing to try to move towards universal access, we understood we had to change the payment system. So we are actually trying to reward value rather than the fee-for-service driven volume. And we actually have had some success there because we have a higher rate of insured and a lower cost than the national average. And frankly, we have to ingrain into our healthcare reform those system changes, because no matter how you pay for this, whether it's whatever tax you pick that you don't like, if the cost of health care is increasing at twice, 3 times the rate of inflation, wage growth, profit growth, it'll fall under its own weight. So this is the moment where we have to have system reform.
Representative Cooper, the president was so adamant this year that staying with the status quo is just not good. And are we getting into trouble because we're trying to create something that is perhaps perfect instead of trying to make something that's perhaps just better?
Well, the president's exactly right. The status quo is unsustainable economically. Medicare alone is an estimated $34 trillion in the hole financially. So the status quo won't work. And the president's right, too, that we first do no harm. Legislation needs to make things better, not worse. And the CBO report yesterday really was devastating because it said that 2 out of the 3 congressional bills would actually make the problem worse, not better. So it's a time to go back to the drawing board, come up with better legislation that supports the president's goals.
You have been a proponent of MedPAC, a really sort of an overseeing body that would really, in a nonpartisan way, help govern health care in this country. Are you convinced it's still the right way to go?
Absolutely. Congress has done a terrible job of managing one of the best programs in America, Medicare, but we haven't managed it very well. That's why Medicare is $34 trillion in the hole. And MedPAC every year comes up with good advice on how to fix problems in the program. But guess what? Congress routinely ignores that advice. This is a way to give MedPAC some teeth so that we have to listen to their advice. We can still override it if we need to, but at least we have to pay attention because Congress is usually very poor at doing its homework.
But you know what's interesting listening to the two of you speak? And I'd like to bring the two of you into the picture if I could. You sound like you're saying the exact same thing. So where's the problem?
Well, I think the problem is it's tough to work on the cost control side. There's really a couple of parts of this bill that are tremendous, and they need to be done, and they need to be done yesterday. One is insurance reform, not just the public option, but private insurance companies have to play by a set of rules where they can't deny a coverage because of a pre-existing condition. They can't yank your coverage because you get sick. They can't deny a coverage because of your gender or your age. And those are solid parts of this bill. Second, we've got to extend coverage to the Americans who don't have it and guarantee folks that if they lose their job, they don't lose their coverage. Every other country has it. Our businesses need that just for competitive reasons. But the third part and the most difficult is we've got to control the cost. And in fact, I think Jim is correct in saying that we've got to empower an agency like MedPAC to take the decisions and implement the reforms, like move to a value-driven rather than fee-for-service-driven system.
So one final question before I have to bail out. Do you both think that there will be legislation on the president's desk before everyone takes August recess?
That was never, well, the House and the Senate can act.
That's our challenge.
He will not have it on his desk because that involves a conference report. Look at October for that deadline.
I had a funny feeling that the timing, the clock is ticking, and we're going to be looking at a different time frame. Jim Cooper and Peter Welch, thank you for taking time from your lunch break to be with us today.